Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and today we will talk about urogynaecology. We divided this lecture into 5 sections. In the first section we will talk about anatomy and the nerve supply of vesicourethral unit, and then what's the physiology of micturition and urinary incontinence. In the second section, we will talk about genuine stress incontinence. And in this, we will talk about what's the pathogenesis, grade, and risk factor of stress incontinence. What are the anatomical changes that leads to stress incontinence? And then what's the clinical features and presentation of stress incontinence. In the third section, we will talk about the clinical assessment and examination of the patient with urinary incontinence and how we can do different investigations and examination of the patient. Then in the fourth section, we will talk about the treatment of the stress incontinence, how it is prevented, what are the drugs used to treat incontinence, and what are the surgical procedures performed to treat the stress incontinence. And in the final and fifth section of our lecture topic, we will talk about overflow and urge incontinence, what's the painful bladder syndrome, and what's overactive bladder. So these are the topics covered in our lecture, Urogynaecology. Hopefully you are interested to learn more about this lecture, so keep watching sqadia.com.